Welcome to the Academy of Online Radiology Education. This is Mohab Almar from Baylor College of Medicine, and I'll be talking about what's new in liver imaging for August 2020. First, I would like to acknowledge our senior editors, and I'll start with the diagnostic performance of LI-RADS treatment response algorithm for HCC. In this paper by Park and published in Radiology, the authors wanted to compare the diagnostic performance of MRI ancillary features in category adjustment with the LRTR algorithm in CT and MRI for the detection of tumor viability. The authors found out that the MRI LRTR viable categories had a sensitivity of 76% and specificity of 83%. When they added the MRI ancillary features into the MRI modified categories, the sensitivity went up to 84% and specificity was around the same. The authors concluded that the application of MRI ancillary features to the LI-RADS treatment response algorithm resulted in higher sensitivity and no change in specificity in the prediction of pathologic tumor viability. Our next study is the application of LI-RADS version 2018 ancillary features to upgrade from LI-RADS 4 to LI-RADS 5 on gadoxetic acid enhanced MRI. In this study published by Lee in the European Journal of Radiology, the authors wanted to see if we can use the MRI ancillary features to upgrade LI-RADS 4 to LI-RADS 5. The diagnostic performance of the upgraded LI-RADS 4 using the ancillary features was compared to the standard LI-RADS 5 category. Four ancillary features were independently significant features for diagnosing HCC. These are mild to moderate T2 hyperintensity, hepatobiliary phase hypointensity, non-enhancing capsule, and mosaic architecture. By using the upgraded LI-RADS 5 criteria, sensitivities were significantly increased compared with the standard LI-RADS category, whereas the specificity were not significantly different. Therefore, the authors concluded that we can use the independently significant ancillary features to upgrade from LI-RADS 4 to LI-RADS 5 to improve sensitivity without impairing specificity on MRI. Next, we have contrast-enhanced ultrasound with sulfur hexafluoride and perfluorobutane for the diagnosis of HCC in individuals with high risk. In this study published in Radiology, the authors wanted to evaluate if PFB-enhanced ultrasound is superior to sulfur hexafluoride enhanced ultrasound in diagnosing HCC. The results of this study showed that the sensitivity of 79% was higher with PFB-enhanced ultrasound than with SHF-enhanced ultrasound, and the specificity was 100% for both of contrast agents. Although PFB is not yet approved for liver use in the United States, it provides a better diagnostic performance than the traditionally used SHF. Next, we have a meta-analysis titled Contrast-Enhanced Ultrasound LI-RADS for Diagnosing Hepatocellular Carcinoma, published in Liver International. In this study, the authors wanted to evaluate the diagnostic performance of LI-RADS 5 category and the proportion of HCC in each LI-RADS category. The study found out that the pooled pair observation sensitivity and specificity of LI-RADS 5 for diagnosing HCC was 69% and 92% respectively. The pooled proportion of HCCs were 0% for LI-RADS 1 and 97% for LI-RADS 5. The authors concluded that the LI-RADS 5 category showed moderate sensitivity and high specificity for diagnosing HCC. Our last study is a basic science study titled Assessment of Hepatitis and Fibrosis using DTPA MRI in dogs. In this study, the authors measured the relative signal intensity of the common bile duct and gallbladder and evaluated the relationship with the biochemical parameters of liver function. They also measured the relative contrast enhancement indices of the liver, and differences were measured between normal and diseased liver. This study showed that the relative signal intensity was not significantly different between dogs without and with a histopathological diagnosis of liver disease, although they were significantly correlated with albumin in dogs with histopathological diagnosis of liver disease. The relative contrast enhancement indices were significantly higher in normal liver tissue than that in livers with fibrosis or hepatitis or HCC as well, but not nodular hyperplasia or hepatocellular adenoma. The authors concluded that the DTPA MRI might be useful in assessing hepatitis and hepatic fibrosis in dogs. Thank you for your time, and for more information, please follow us on Facebook, Twitter, or LinkedIn. Thank you.